Hello, my name is Gabby, and I'll be your nurse practitioner for today.
Okay.
I'll be performing an assessment of your head, eyes, ears, nose, throat, respiratory, and cardiovascular system, okay?
Okay, sounds good.
I'll be explaining each and every step as we go along, so feel free to ask any questions. Okay, let's start with your name. Can you tell me your first and your last name?
Mary Smith,
And your date of birth?
2/15/2000.
And before we begin, Mary, do you have any allergies?
No, I do not.
So first, I'm just taking an overall assessment of my patient, Mary. Mary seems to be in appropriate clothing and she's well groomed. And Mary, can you tell me where we are today?
We're in the doctor's office.
And what year are we in?
2025.
Okay, so Mary is awake, alert, and oriented ×3. She's making good eye contact. And just looking at her skin is nice and even. And her skin tone is appropriate for her ethnic background. I'll just be putting on some gloves. I'm just going to be examining your head and face by palpating your scalp first. I'm just palpating to see if you have any masses, and just let me know if you feel any tenderness when I press down.
Okay.
Any pain?
Nope.
Okay, and I don't feel for any palpable masses. There's no lesions on the scalp that I can see. And I'm just going to be looking at your face. Your face is nice and symmetrical. I don't see any drooping or involuntary movements in her face. I'm also going to be testing for a couple functions of your cranial nerves. So I'm going to ask Mary, look at me straight and give me a nice big smile. And I'm going to ask you to frown and raise your eyebrows as high as you can. Good. And this is testing function in cranial nerves 5 and 7. Now, Mary, I'm just going to ask you to close your eyes, and you're just going to tell me once you can feel the sensation on your face, okay?
I feel it. I feel it. I feel it. I feel it.
Great. You can open your eyes, and this is just testing cranial nerve number 5. Now I'm going to be palpating your masseter and temporal muscles. I'm going to start with your temporal muscles. Any tenderness?
Nope.
And then clench down with your teeth. Good. And your masseters. Any tenderness?
Nope.
And the muscles feel nice and firm, and they're symmetrical. Now we're going to be moving on to examining Mary's eyes. So first we're going to do a test of your visual acuity and distance. So I'm going to hold up this Snellen chart. I'm going to be standing 20 feet away, and you're going to read off the smallest line that you can, okay?
Okay. A, C, F, D, E.
Okay, great. So Mary was able to read this line here, testing for her visual acuity. Her acuity is 20/10. Now we're going to be testing your peripheral vision. I'm going to ask you to cover your left eye with your left hand.
Okay.
Good. And you're just going to tell me when you can see my fingers wiggling, okay?
Okay. I see it. I see it. I see it.
Good. We're going to do the same thing with your right eye.
I see it. I see it. I see it.
Excellent. You can uncover your eyes. Now I'm going to be testing your corneal light reflex. You're going to look straight at my face, and I'm just going to be shining a light down the bridge of your nose. Okay, so look straight at me. Good. The corneal light reflexes are nice and symmetrical. Cover your left eye with your left hand. Just look straight at me. And I'm going to ask you to do the same with your right eye. Good. And I don't see any deviation. And I'm going to ask you to follow my fingers with your eyes only. You're just going to keep your head straight. Okay? You're going to trace my fingers with your eyes. Excellent. And now we're going to be testing your pupils. Just look straight. Good. And Perla is present, meaning her pupils are equal, round, reactive to light, and accommodate. Now I'm just going to be taking a look at your eyes, looking at your sclera. Your sclera are nice and white. There's no yellowing or jaundice that I can see. I'm just going to look at your conjunctiva. They're nice and pink. They're not pale. They're nice and moist. I don't see any drainage. The eyelids and the eyelashes look good. And there's no abnormalities when I'm looking at her eyes. So now we'll move on to her ears. I'll just be doing a visual inspection of both ears, making sure that they are symmetrical. They're in good shape. I don't see any abnormalities to the skin of her ears. I'm just gonna press down on the pinna and the tragus of your ears. You're just gonna let me know if you feel any tenderness, okay?
Okay.
Any tenderness?
Nope.
Any tenderness?
Nope.
Great. Now I'm just gonna be performing a test with my otoscope. I'm gonna be looking down the canals of your ears. So this is the canal of the left ear. I don't see any redness or drainage. There's no excess cerumen. The tympanic membrane is nice and pearly gray, and I see a nice cone of light. Again, I don't see any redness, drainage, or swelling in the canal. No excess cerumen. The tympanic membrane is nice pearly gray, and I see a nice visual cone of light. Now I'm going to be doing a series of hearing tests. So we'll start with the whisper test. I'm going to ask you to cover your left ear with your left hand, and you're going to tell me what word you hear. Okay?
Chicken.
That's correct. Okay, good. Now we're going to be moving on to your nose. Your nose is nice and symmetrical. I don't see any skin abnormalities on your nose. It's nice and midline. I'm just going to be palpating the bridge of your nose. Okay. Just tell me if you feel any tenderness.
Nope.
Any tenderness in the soft tissues of your nose.
Nope.
I'm going to be palpating also your sinuses. Any tenderness?
Nope.
Any tenderness?
Nope.
Good. I'm going to be looking now in the nasal cavities. I take my otoscope and look into the nasal cavity. I'm looking in the left nasal cavity first. The nasal mucosa is nice and pink. There's no redness, no drainage. And the septum is nice and midline. There's no deviation. I see it's nice and patent. Right nasal cavity. The mucosa is nice, pink and moist. I don't see any drainage or no abnormalities. There's no deviation in the septum, and it's nice and patent. Okay, I don't see any polyps or discharge as well, okay? Now, can you close your eyes and identify this scent for me?
Okay.
Okay.
Orange.
Orange, that's correct. Okay. Now we're just going to do an inspection of your mouth and your throat. I can see your mouth is nice and symmetrical. Your lips are nice and pink and moist. I don't see any ulcerations or lesions around the mouth. I'm going to ask you to open your mouth nice and wide. Just taking a visual inspection of the mouth. The buccal mucosa is nice and moist. The gums are pink. No lesions or swelling present in the mouth that I can see. I'm going to be taking my tongue depressor. I'm just looking good. The hard and the soft palate are nice and intact. Now I'm going to ask you to stick out your tongue as far as you can and move it to the left and to the right. Good. And then I'm going to ask you to open your mouth again. Stick your tongue out nice and big and say, ah, ah. And I'm watching the uvula rise, and it rises midline. There's no redness or swelling back in the uvula. And now I'm just going to be doing an assessment of her neck. Good. I don't see any visual abnormalities on the skin of the neck. I'm just going to palpate your carotid arteries one by one, okay? Good. I don't feel any thrill. The pulse is nice and strong. It's a +2 pulse. Again, no thrill. There's a strong pulse present, +2. Now I'm just going to palpate your throat. The trachea is nice and midline. I'm going to come from behind you and again palpate your throat. And now you're just going to swallow. So swallow for me. The thyroid is nice and midline as well. Okay, and now I'm going to auscultate your thyroid. And there's no bruise heard, which is good. I'm going to be listening to your carotid arteries as well. Excellent. And I don't hear any bruise in your carotid arteries. So now I'm going to palpate your lymph nodes. of your neck. And just tell me if you feel any tenderness.
Nope.
Nope. Tenderness?
Nope. Nope.
Nope. And in your exhale. Any tenderness?
Nope.
Excellent. And now I'm going to be assessing your respiratory system.
Okay.
Okay? And I need you to sit up nice and tall and breathe normally for me. I'm just going to assess for your expansion. I'm going to have you hug yourself or make an X with your arms. Good. I'm just going to be moving your hair. And I need you to take a nice deep breath in and out. In and out. In and out. And expansion is nice and symmetrical. Now I'm going to be testing for tactile fremitus. Each time I place my hands on your back, you're just going to say 99, okay?
Okay.
Okay. Nice and loud, okay? 99. 99. 99. 99. Okay. And there's no tactile fremitus noted, which is great. And now I'm just going to be assessing your breath sounds. Okay. So take nice deep breaths in and out. Good. Posterior breath sounds are clear and equal bilaterally. There are no adventitious breath sounds that I hear. We're going to do the same with the anterior chest. Again, breath sounds are nice and clear bilaterally, and I do not hear any adventitious breath sounds. I'm now going to inspect the shape and symmetry of your anterior chest. Okay, so sit nice and tall. Take a nice deep breath. Good. And upon inspection, symmetry is the same in the anterior chest. I'm now just going to assess your respiratory rate and pattern of breathing, okay?
Okay.
So just breathe nice and normal. Okay, good. Respiratory rate is 17, and her breathing is nice and normal. It's not shallow, it's not too deep. And then just take slow, deep breaths in and out through your mouth. Okay, great. Okay, now we will be assessing your cardiovascular system. I'm just going to auscultate your heart sounds in the aortic, pulmonic, Erb's point, tricuspid, and mitral areas, okay?
Okay.
Good, I hear a nice lub dub. There's no abnormal sounds that I hear, no S1, no S2, or heart murmurs. Okay, now I'm going to be assessing for JVD. I'm just going to have you turn your head to the side. Okay. And the other side. Now I'm going to be palpating the pulses in your arms and your legs, okay?
Okay.
Just checking for the brachial artery. Good, there's nice and strong pulse. Radial. Same on this side. And on this side. Good, the pulses are nice and strong. Now I'm going to be just checking your femoral pulse. So just straight down your legs. Okay. Femoral pulse is good. Femoral pulse. Popliteal. Popliteal. And now as I examine her lower extremities, I'm looking to see if there's any edema, swelling, which there's not. The skin tone is great. Tibial. Tibial. And the dorsalis pedis. And great. All pulses are equal and strong. And this concludes our head, eyes, ears, neck, throat, respiratory, and cardiovascular assessment. Do you have any questions for me?
Nope, I don't.
Thank you for being in this video with me.
Thank you.